early summer 2019, I went to the emergency department at UAB Hospital. This is University of Alabama at Birmingham. It's located on the south side, downtown Birmingham, Alabama, USA. And I had this injury in my head, and you can find out all the details about what happened to me and what this possibly is on my YouTube channel and elsewhere. Search My Medical Nightmare and you'll find it. So in brief, I had a broken skull injury. I had this from around July 2018. I went around to many doctors and hospitals in Birmingham. Tried to get this thing diagnosed. And we're not even talking about treatment, just trying to find out what happened to me. And I repeatedly found that the doctors they wouldn't diagnose this thing. They wouldn't look at it for some reason or another. I don't have insurance and I have no source of income, and I think this may be part of the reason. And this is in the hospital. This is a violation of a United States federal law, and this is EMTALA, EMTALA. And this states that when you go to a hospital in the United States of America, the hospital is obligated to treat your injuries, but it hinges on the diagnosis. And what I found happened to me was the hospitals will repeatedly misdiagnose me in order to circumvent complying with this law. All right. But what I did was, okay, so I'd go in and I'd say, man, my neck feels like it's broken. So they'd come back and they'd say, oh, you just pulled a muscle. And then they would tell me there were no injuries that showed up in the CT, X-rays, and MRI scans that I had done. Okay, well, there's another law in America, and this allows patients to obtain their medical records. And yeah, I found out some of my medical records were edited to cover the doctors and nurses' errors. But yeah, I got my own records, and here's what I found in many of them. And in the images. You can get your own images that are taken also. So in the images, exactly in the area where I had the pain that I went into the hospital and complained about, I found that my skull was broken. It's in the basilar area of my skull, around the occipital condyle condylar canal, possibly foramen magnum. This is a very serious injury. I had a hole in the bottom of my skull, and there's fluid inside your skull between your brain and your skull, and this leaked out into a wound in the upper area of my neck, and this all shows up in imagery. So because I couldn't get proper diagnosis and treatment, this area became gradually infected, and then later I found out it was infested by microorganisms, parasites, and worms. And all of these things can be seen in the MRIs and CT scans. It was that bad. Alright, so this brings me to our video today. And this deals with UAB Hospital. So I went to UAB, and they have some expertise in many of the areas that I think concern my injury, and we never got to test those because they wouldn't see me. So yeah, I went to the hospital. It was in June 2019, and I was triaged. I complained of I told them I thought my neck was broken or my skull was broken, and I also said that I possibly had a CSF leak. I took in past imagery, MRI, CTs, and X-rays that show the injury itself, and I showed this to the triage nurse. So I was triaged, and I stood in the waiting room, and I waited there for 5 hours. So after 5 hours, it was like 1 or 2 in the morning, and I couldn't stand any longer. The waiting room, it was like full of people. There were no chairs or seating available. So yeah, I had this injury. I stood 5 hours. I was holding on to consciousness the best that I could. Hopefully try to see a doctor. And the doctor, they never saw me. I was never called back to the back of this hospital to be looked at. So yeah, I believe that the UAB, they're using this method of waiting out patients with the 5 hour waits. And when I was there, yeah, I heard about people who were sitting there for like 10 hours. So yeah, I think UAB, they're using the triage waits as another method to circumvent EMTALA. They're waiting people out. So if you stand there for 5 hours and you can't stand any longer and you leave, they don't have to see you. I filed a complaint against University of Alabama At Birmingham Hospital from this visit, the Centers for Medicare and Medicaid Services. So they launched an investigation, and they investigated UAB Hospital for my complaint. And I got this back in January of 2021, and it's from the Centers for Medicare and Medicaid Services. And they tell me that they did not confirm violation of the emergency care obligations for UAB Hospital. Yeah, I think this is very unfortunate. My concerns are valid, and I'll go into what happened to me briefly. So yeah, I went in there, stood for 5 hours, was not attended to. My triage condition, I just explained it. You can see here, these are my medical images. This is the condition that I had when I was waiting for 5 hours and not attended to by this hospital. So yeah, the lobby, the waiting area, it was full of people. There were a lot of homeless people in this waiting room, a lot of drug addicts. And I was standing near the front desk. I watched the people come in and out, and I watched them call the triage list to the back to be attended to. And their triage list is strange, all right? By and large, okay, I had this injury, right? But by and large, the people they were calling back to be attended to, these were like withdrawing drug addicts and stuff. And I don't know how this is listed as a more important condition than what I had, for example. But yeah, there were mosquitoes that flew around inside this waiting area. That's not good. Mosquitoes are a disease vector. A mosquito is like a flying syringe, all right? So the mosquito flies through the waiting area, and it lands and it sucks the blood out of one person, right? So if it lands on you or lands on me, this can it can pass diseases around, and this is not good, and especially UAB, not acceptable. I got water. They had a public water dispensing machine. I poured water to a styrofoam cup. Small black worms dropped out of this machine into the cup that I poured water into, and I can't drink that. The other thing that I noticed, The atmosphere of the triage area in the waiting area of UAB Hospital in the emergency department, it's like a college dorm room. Yeah, and many of the nurses there and the medical staff that you can see, they are visibly young, like incredibly young. And then another thing, around this emergency department in UAB Hospital, there are all these fast food restaurants. And the nurses and the staff that worked in this place, they had, takeout fast food and drinks. They were laying around on the triage table, right next to all this expensive medical equipment. They had like Domino's pizza boxes and all this stuff, and they're sitting there eating. At the same time, they're attending to these triage patients, and this is disturbing. This is not a professional environment. That's my opinion. But UAB, they have plenty of money. Obviously, you can look around at the south side of downtown Birmingham. You can see all the real estate that's owned by UAB, and then all the other companies that exist around UAB that service UAB. Yeah, so I'll show here. These are my pictures. Okay, so here's the injury that I had, and I stood there 5 hours, was not attended to. I believe that I was patient dumped, and this is a violation of EMTALA. And they're using the 5-hour waits to wait out the patients, so they don't have to attend to them and then enter into this this zone where they have to they're obligated to provide treatment. That's my belief. And so I filed a complaint with the Centers for Medicare and Medicaid Services. They did an investigation, and they were not able to confirm the violation. But my claims, they still stand, and I'll put this out here. You can look at the pictures, and I'm telling you what happened to me. It's all in records. And so I'm an armband from this. So you be the judge. And if you have an injury like mine, I would not recommend that you go to this emergency department. Because this is apparently not an injury that's worth looking at. That's my conclusion.